before we go a little bit deeper in the assessment of ankle dorsiflexion, I want to fill you in on three things. One is that the ankle mobility is kind of dependent upon the subtalar joint. So you need to really discern if that subtalar joint is, when it's going through eversion, is the ankle dorsiflexion lacking, which it rarely is. B is when the subtalar joint is supinated or going through supination, which you will commonly find limited in your patients, and I'll tell you about that here in a minute. And then third is if the ankle's in neutral, which is typically in more of a squatting position. So we look at the ankle joint. It goes through ankle dorsiflexion and plantar flexion. It is a triplane joint, but primarily the motion is in the sagittal plane of dorsiflexion and plantar flexion. The abduction, adduction, and inversion, eversion really is kind of unremarkable, and you can't really assess it from a clinical standpoint. But in regards to the subtalar joint affecting the ankle dorsiflexion, this is what we commonly see. So when that subtalar joint goes through that eversion, what it does is it unlocks the mid-tarsal joint. And the mid-tarsal joint is a really good way of compensating. It's got a decent amount of dorsiflexion, it's got a good amount of inversion, eversion, it's got a lot of abduction, adduction, because it has two axes. But it will compensate in that oblique plane where it will dorsiflex if the ankle joint is lacking. So take-home point is this: rarely is it limited, the ankle dorsiflexion limited when the subtalar joint is going through eversion. And this is something you would commonly see if a patient was doing a lunge and gait. When the knee was kind of dragging in, they would need a good amount of ankle dorsiflexion with the subtalar joint going through eversion. Or similarly, if I was a golfer and I need to swing my hands this way, then I would get ankle dorsiflexion with that subtalar joint going through eversion. But from a clinical standpoint, what we really see is a lack of ankle dorsiflexion when the subtalar joint is going through supination. And this happens because the subtalar joint is going through inversion, which locks up that mid-tarsal joint, and that mid-tarsal joint can't compensate and dorsiflex. So the ankle has to really move as much as possible in that sagittal plane into dorsiflexion. So here are a few common assessments that you can use to assess that. So Patrick's going to be my assistant here, and Pat, why don't you just go ahead and stand on that left leg, and let's have you just kind of reach and step towards that pink line there. And as you can see here, we're checking the dorsiflexion at this ankle joint, but the subtalar joint is also kind of going through that inversion position. Similarly, I could also pre-position his hands to the left here, which is going to kind of make me rotate a little bit more of my hip joint, which is going to affect the subtalar joint from the kinetic chain. And then I can have him squat that way. So Pat, do that for me. Good. And then a quick test that I like to do is just kind of do a little skier squat. So Pat, go ahead and go to the right for me. So on the right side here, his ankle joint is going through dorsiflexion with the subtalar joint inverted, versus on the left, it's going with it pronated. And then he can go ahead and squat back this way. And you can see here, compared from the right to left, his left ankle joint doesn't move as far, which you would expect when his subtalar joint is going through supination. So now if he goes back to the right, you can see he's got a little bit more motion. And that's because that mid-tarsal joint's getting unlocked and he can get a little bit more dorsiflexion kind of at that mid-tarsal joint to compensate. Another quick and easy test that you can do, and this is particularly when the subtalar joint is pretty much neutral, it's just a squat pattern. So Pat, go ahead and just do a deep squat for me. And you can see here, he's pretty good ankle dorsiflexion and then back up. And you can just have him drive those a few times. So go ahead and do a few of those for people out there in video land. And obviously you just want to look to see, okay, does he have adequate amount? And that's how you would measure this functionally. So there you have it. There's three ways you need to assess ankle dorsiflexion: one with the subtalar joint everted, one with the subtalar joint inverted, and one with the subtalar joint rather neutral.